Welcome to this explainer. Look, if you're a parent, you know the exact feeling we're talking about here. It's midnight, the whole house is totally quiet, but suddenly you are wide awake, dealing with the rising panic of a rising thermometer. The numbers just keep ticking up, and your heart is pretty much racing right along with them. Well, today we're going to look at a totally paradigm-shifting approach to managing a child's fever. We're going to explore exactly what you should be doing before you even think about opening up that medicine cabinet.
So, the thermometer hits 102 degrees Fahrenheit, then maybe 103, and boom, that immediate panic sets in, right? You're asking yourself, do I need to give the medicine, like right this second? And honestly, it is incredibly validating to feel that anxiety. Your first instinct is just to fix it, to fight that scary number on the screen. You wonder, should I cool them down? Should I try to force them to eat something? Is this dangerous? But here's something a lot of parents actually don't realize. Treating a fever doesn't always mean handing out medication right out of the gate.
Let's dive right into Section 1, the physics of fever, looking at heat produced versus heat released.
It actually turns out that your child's body temperature ultimately boils down to a very basic physics equation. On one side of the equation, we have heat production. This is driven by their physical activity and, surprisingly enough, digestion. Yeah, just digesting food creates internal heat. On the flip side, we have heat release, which happens naturally through breathing, skin circulation, and sweating. Understanding this exact breakdown is honestly so empowering because it shows you exactly how you can intervene naturally to kind of cool the house down before you ever resort to medication.
And that brings us to the real foundation of proper fever care. It's a simple, three-step non-medicinal treatment plan. Number 1, reduce activity. Number 2, cool the room. And number 3, hydrate. Now, these are not passive measures at all. They are highly active interventions. So let's break down exactly how each of these 3 steps impacts that physics equation we were just talking about.
Moving to step 1, reduce heat production by slowing down the internal furnace. When a kid is really active, running around, or honestly even just crying intensely, they are producing a lot more heat. Simply having them rest and maybe even skipping meals for a short bit, since digestion requires that heat-producing energy, drops their heat output instantly.
On to step 2, help the body lose heat, specifically looking at the breathing mechanism. We really need to focus here because this is where a lot of us make a pretty big mistake.
Picture this for a second. Your child inhales room air that's, say, 68 degrees Fahrenheit. When they breathe out, that air has been warmed up by their body to nearly 100 degrees. That means heat is literally leaving their body with every single breath they take. But if they're in a room that's an overheated 82 degrees, way less heat can actually escape. That extra heat just gets trapped right inside their core. Overheating a sick kid's room is totally counterproductive to what we're trying to achieve.
So, the real sweet spot here is maintaining an ideal room temperature of 64 to 72 degrees Fahrenheit, which is about 18 to 22 degrees Celsius. Look, I totally know the caring parent instinct is to wrap a sick, shivering child in 5 heavy blankets like a little burrito, but physiologically speaking, that often makes the fever so much worse. Keep the room comfortably cool. Dress them in light pajamas, maybe some socks if they really need them, and honestly, only give them a blanket if they specifically ask for one.
Step 3 is the hydration requirement, which is all about fueling the body's cooling system.
This right here is arguably your absolute most important non-medication intervention. There's a very strict physiological chain reaction at play. Sweating requires fluid. No fluid means no sweat, and no sweat means poor cooling. It's that simple. We're talking water, oral rehydration solutions, diluted juice, maybe fruit compote, electrolyte drinks, or even some warm broth. The absolute best fluids are going to contain water, sugar, and electrolytes. And hey, if your child completely refuses to drink a large amount at once, that is completely fine. Just encourage tiny, frequent sips. Hydration is simply not optional here, folks. Without it, even the fever-reducing medications become far less effective.
Okay, let's pivot to some dangerous old-school myths. Essentially what not to do when that midnight panic sets in. We really need to deconstruct these because some of them are downright harmful.
First and foremost, and I can't stress this enough, absolutely never use alcohol or vinegar rubs. This is probably one of the most dangerous traditional fever remedies still floating around out there. Yes, technically alcohol evaporates quickly and removes heat, but children easily absorb these substances right through their skin, plus they inhale the vapors. Rubbing a kid down with alcohol can literally lead to dangerous intoxication, and vinegar can severely irritate their skin and airways. Major pediatric organizations emphatically advise against this. Just don't do it.
Next up on the myth-busting list is the ice bath. Now, from a pure physics perspective, sure, ice cools things down fast. But from a medical perspective,
It backfires terribly. Extreme cold causes the blood vessels in the skin to constrict super tightly. When those vessels clamp down like that, way less heat can escape through the skin. So you end up in a situation where the surface of the skin feels freezing cold to the touch, but that dangerous high internal heat gets completely trapped inside the core, and it can even rise. Never, ever use ice baths or freezing compresses.
If you are gonna use water to help cool your child down, you've got to keep it right in the safe zone, 90 to 95 degrees Fahrenheit, which is 32 to 35 degrees Celsius. A gentle, lukewarm sponge bath helps that heat escape safely without triggering that dangerous blood vessel spasm we just talked about. But remember this absolute rule. If your child begins to shiver or cry intensely, stop immediately. We want to comfort them, not traumatize them, right?
Now let's talk about recognizing real danger signs and knowing exactly when to seek urgent care. You need to know when to step back and call a professional.
The biggest tell here is actually the skin. If your child has a high fever, but their skin is pink, warm, and well perfused, that is generally a very reassuring sign. It basically means their circulation is good and their body is mounting a safe, fully functioning immune response. But we have to contrast that directly with vascular danger signs, which strongly indicate poor circulation.
Listen closely to this checklist because it's absolutely crucial. If a high fever is paired with pale, gray, or bluish skin, or unusually cold hands and feet, these are urgent warning signs. A child showing these poor circulation indicators needs to be assessed by a medical professional immediately. Do not wait and do not try to manage this at home.
Now, assuming those danger signs aren't present, I want to share an incredibly empowering fact with you. Resting, cooling the room, and hydrating, those are highly effective, real treatments. I know a lot of parents feel super guilty, almost like they're doing nothing unless they're dispensing medication. But in a lot of cases, this proper non-medicinal care lowers the temperature naturally by 1 to 2 degrees Fahrenheit. And very often, that is literally all the child needs to start feeling better.
Which leads us perfectly into the golden rule of pediatrics. Treat the child, not the thermometer. A fever is not automatically the enemy here. It is very often an essential part of the immune response working hard to fight off an infection. Your ultimate goal isn't to go to war with some digital number on a screen. Your goal is to safely support their body and help them feel as comfortable as possible while their immune system does its job.
So, I want to leave you with this final provocative thought to wrap up our explainer today. The next time that thermometer spikes in the middle of the night, ask yourself, is your environment truly optimized before you reach for the medicine? Is the room actually cool? Are they dressed lightly? Are they resting quietly? Are you offering them tiny sips of fluids? Assess the whole environment first, because sometimes the absolute most powerful, effective treatment you can offer your kid doesn't come from a bottle at all.